You're seeing this for the first time? So am I. You know, I'm grateful that Derek, Davis, Joe, Heather, they honestly believe you can teach an old Doug new tricks. We'll see. Key elements of the Tripartite First Nations Health Plan. We are in the third year of a 10-year plan. That plan has 4 key elements: governance, relationships, and accountability. And that's what I spoke to this morning. And that is what today is all about. It begins with us defining our responsibilities, defining our inherent right of self-government, our jurisdiction, for ourselves, and determining how we will work with our brothers and sisters in neighboring nations, how we'll work together in regions, how we'll work together in British Columbia and with other First Nations in Canada. We also have health promotion, injury, and disease prevention. And when you look at the 10-year action plan, you'll see a number of action items. Those action items relate to this theme. Health services. I talked about the importance of our governments making decisions. Today, all of the programs and services that are delivered, those programs are designed in Ottawa, Victoria, or by folks that are responsible for services in the various geographical authorities. We want to make sure that we take our place at the table and that we find the capacity, the expertise within ourselves to design programs and services. When we learn about the delivery and implementation of those services, that we make changes as we go and that we make sure that we put our people first. One of the things that we're expected to do is to make things better. I think it was Andy talked about the importance of health determinants and about how what we're really talking about is a sickness system. We can create a great sickness system, but it'll do nothing to improve the wellness, the well-being of our citizens, our families, and our communities. So one of the things that we want to design is a performance tracking system that talks about wellness. It means then that part of what we need to do as part of this work is develop institutions that allow us to influence federal and provincial policy as it relates to housing, infrastructure, employment and training, education, K-12 and post-secondary, languages, all of those different things that are fundamental to the well-being of our communities, known as determinants of health, that we need to build those institutions and to create a tracking system that measures all of those things. Andy, I think it's your turn.